Fellowship of the Great Physician welcomes you to House Call. You are Dr. Chiropractic, Dr. Gerald Lala, and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Rockville, Minnesota. Let's join our host for today's program, 7:15 in your friends,
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's wonderful to have you with us again on House Call. This is part 7 of You and Your Hormones. And so it's a series on you and your hormones. And we've covered a lot of information in the first 6 parts, and we're going to cover some more here with you now. And so hormones are so important, and we're going to start by discussing what is called the hormone axis of influence. And so all of our hormones are interrelated by different organs. So what we're going to look at is first we're going to talk about the thymus. And then that affects then the hypothalamus gland. And then after the hypothalamus, the adrenal glands are affected. And from the adrenal glands, the ovaries are affected, of course, in the female, and the testes in the male. And then hormones then affect all other tissues. So they are biochemically interrelated. And they have what is called a metabolic pathway. In other words, the way the body secretes, the way it manufactures or synthesizes and secretes hormones is very specific. It's not a hodgepodge kind of thing. It's all very organized. And that's why no human could have created the human body. No one could have come out of an animal. I didn't come from a frog. I came from God created me, all right? And so what Dr. Jensen is going to do is begin doing a little review of how those hormones are affected, how they are secreted, but he is also going to talk about caveat emptor first, right?
Okay. Thank you, Dr. Lala. Well, caveat emptor means just because it's advertised on TV, radio, newspaper, church, or in a synagogue, it does not make it right or without adverse effects.
So just because we're on television doesn't make us right. No. We hope to be right. One is we're held to standards by the rules and regulations of the Minnesota Board of Chiropractic Examiners, so we better know what we're talking about.
By sheer result of being licensed, they can yank your license and things like that too.
But number 2 is being ordained ministers as well in a non-denominational perspective. We're looking to Jesus as judging us too. Are we being honest? Do we know as much as we possibly can know at the present time? So just because we have a bunch of credentials, just because we have a school of health and healing where Jesus people meet every Thursday night, doesn't necessarily make us right. But what we're not giving is so much our opinions, but what we know about science, as biology, the basic sciences, as well as what we know about God's Word, right?
So we seek excellence in order to glorify Christ.
That's right, and we seek to improve every day.
Right.
Okay, great. So what are the pathways, the synthesis of hormones then?
Okay. First of all, I'll draw your attention to the top of the chart where we have cholesterol and pregnenolone. And as I toggle between these 2 charts here, nope, we don't have that second one there. So what we find is there's a whole another chart there that has the corticosteroids also, and those are also based upon cholesterol and pregnenolone. So what we have is, in this case, this is just your sex hormones in this case. It starts out with cholesterol, and by the way, by driving down your cholesterol, you're also driving down those necessary chemicals that need to be in your body for manufacture of these hormones. And that's, by the way, also why God didn't just leave it up to you eating cholesterol and ingesting it that way, but 80% of your cholesterol is created within your liver.
And the statin drugs then, the majority of them affect the liver's ability.
They seek to lower your cholesterol by limiting the amount of cholesterol that your liver can create.
And they also cause adverse effects on the function of the liver as well.
Right, as well as that enzyme that's responsible for creating cholesterol in the liver also has responsibilities for creating other housekeeping type chemicals in the body, most notably coenzyme Q10, which is a high free radical scavenger within your body. So cholesterol then from that, that's the precursor to pregnenolone, which we've talked about on an earlier program. I would tell you to, if you'd like some more information on some of these other hormones, to go back and review our other programs there, and you can do that by going onto our website, www.housecalltv.com, or .org, .org, because there we've presented these videos streaming on there for you. So let's go back to pregnenolone. It's 17-hydroxypregnenolone is created from that, and that is the precursor to DHEA, which, as you can see there, is very important because there's a number of products that come from that where that is the precursor. What we find is it goes into etiocalanilone and androsterone. Also, androstenedione, which is a precursor to your entire estrogen family of hormones, as well as testosterone. And so, by cutting down on some of these precursors, such as the cholesterol, as well as trying to control that and how it affects the rest of your hormone system, can affect your entire body as a whole, since the hormones are a signaling mechanism as well as changes the entire function and composition of your body. If we go on, we're going to look at androstenedione a little bit closer now, as we've done with the other hormones. We're on to androstenedione in this case. It is a precursor to testosterone, estrone, and estriol. And its imbalance leads to such things as polycystic ovarian disease, hirsutism, which hirsutism is where you have abnormal body hair, such as increased testosterone is usually what causes it.
Very common in women.
Very common in women. Ovarian tumors and mood swings that can also occur from increased androstenedione. Then we go on to the estrogen family of hormones. That's estrone, estriol, and estradiol. And estrone, androstenedione, is its precursor, and it's the most abundant female hormone. In perimenopause, estrone levels rise parallel to those of estriol during the follicular phase and peak just before or just prior to ovulation. Now, when you're looking at the ovary and there's eggs in the ovary, they're normally first prepared by causing the follicle. And from that follicle, that when that bursts, it lets off not only the other hormones such as estrogen and so forth, but it lets the egg go out, and then it's allowed to be fertilized at that point. In postmenopause, estrone no longer is produced by the ovaries, and is therefore then that's shifted over to the adrenal glands to do some of that production for you. But that's only if the adrenal glands aren't being fatigued out and not have the raw materials in order to do that for you. So members of the estrogen family, it affords women to have a gradual transition into menopause and the opportunity for a normal sex life, if that's of interest to her, as well as corticosteroid hormones if you measure this and find out what's needed to be done in order to make that a smooth transition. And as always, we don't find this is the last author, but the first author in health is the Creator himself, and this is a ministry, so you should expect that we would tip our hats towards God and know that He has in His mind your health and healing, for God so loved the world that He gave His only begotten Son. And so we look in John 10:10 and John 6:63. We put these together in a phrase to help you get the word in your heart and let you start reacting to that. And so we would say this as a confession, that the healing word of God flows through every organ, cell, bone, and chemical in my body, bringing health and healing to those tissues. So Dr. Lala, as we go on in here, let's go on to some of the abnormalities, with reminding that these people don't have to suffer from these things, that God's word is traveling through them, and not claim these things to themselves, but if they do have them, that they can seek care in some people who would understand and how to help them.
God didn't send Jesus back to have people stay sick or imprisoned. He sent
No.
him back to get healthy and whole. And we're trying to participate in that process. So abnormalities associated with adrenal gland secretion. So we have one little adrenal gland. It's kind of cock-shaped, set on top of each kidney. And so what are some of the abnormalities associated with adrenal gland secretion? Extracellular fluid, we would call that edema or swelling. Decrease in plasma, an increase in the red blood cells, muscle weakness, respiratory infections, melanopigmentation, in other words, dark spots, sometimes we refer to them as liver spots, decrease in cardiac output leading to shock, the heart starts to slow down, doesn't pump as much as it should, and then loss of cholesterol. Now, let's talk about hyperadrenalinism. One of the common diagnostic names for hyperadrenalinism is Cushing's syndrome. Cushing's syndrome involves a deposition of fat in the body. In other words, where fat should be, it's in another place. Angioedema, swelling, acne, skin problems, hirsutism, which Dr. Jensen talked about a little bit ago. Purple striae, that's like little purple, like spider web formations. Muscle cramps, paralysis, hyperglycemia or diabetes, hypocalcemia, low blood calcium, and of course then osteoporosis. Now, there's another condition called androgenital syndrome. What does that mean? Andro would mean adrenal. Genital would have something to do with our genitals, all right? So there's a syndrome involving our genitals and the adrenal glands, and it's manifested as masculinization. Yes.
That connection between the adrenal glands and the kidneys and the sex organs is so pronounced that in Chinese medicine, they usually look at the genitals as a type of a kidney. So when you're treating kidney function, you're treating not only the genitals, but you're also treating the brain and the bones. They're all related through that. And so when you're looking at this androgenital, that connection is very strong in Eastern medicine and is being more and more recognized in Western medicine in this case.
And as one who is certified in Eastern and Western acupuncture medicine, you know a great deal about that. And it's interesting when you examine some of these patients, rather than using a cookie cutter approach to acupuncture, which is cookie cutter approach is, come in, what's wrong? I have high blood pressure. Okay, tick, 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 the needles, right? All right. I have arthritis. Tick, 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 the needles, right?
Right.
Whereas, and that's, again, like saying I have a headache, here's Tylenol. Or I think I have a fever. Oh, here's some erythromycin with no diagnostic testing. So,
right. Such as there's a point on the hand that a lot of people, if you can go buy the books in the store and they'll tell you right away, here's a point that's on the hand that takes care of headaches. Well, it only works like 40 to 50% of the time, and it's due to the other presenting systems of the body. If Oriental medicine works off of heat and cold many times as two of the conditions in the body. And if it's due to a heat condition, then that point on the hand will work. But if it's due to a cold disposition, then it won't work. So many times people will try acupressure or acupuncture and to no avail. And so it's by looking at the person as an individual, coming up with the right diagnosis brings the right
So in fact, they're
right
kind of
treatment.
guessing off of a chart that something is wrong. It's like a chiropractor, somebody going into a chiropractor with a back problem, and they say it hurts here, and the chiropractor goes click, 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 click.
Yep.
No x-ray, doesn't even know if it could be cancer that's causing that, or their arthritis, or a disc problem, you know. So again,
Right.
I guess you could say a Mayo Clinic didn't get to Mayo Clinic by not doing due diligence.
Absolutely.
And if you're going to a chiropractor who does due diligence, who bases what they do on science-based tests, then the likelihood of them coming up with the right diagnosis and the right treatment is much higher. But if you're going to somebody who does not do due diligence, who just does little cursory exams and things like that, or bases things on just a few tests and a philosophy rather than scientific data, the propensity of you not recovering is much higher. So, going back to the androgenital syndrome, the symptoms classically are masculinization, which is manifested with a deepening of the voice, baldness, and increased size of the clitoris. Now, earlier, Dr. Jensen, and probably a good idea to go back on it, when you were going through, not to bring up the chart necessarily, but when you were going through the metabolic pathway of how hormones are produced, you were talking about DHEA, and we said that was like a policeman at an intersection that's directing the pathways of these hormones, that they're going in the right direction. Could you talk more about DHEA?
DHEA, well, certainly when you look at DHEA, it's very important for health. As we look at the slide, the importance of the health is for cardiovascular problems, immune systems, energy, bones such as osteoporosis, memory and skin, also in preventing things such as cancer and aging. In fact, some of these people take DHEA for an anti-aging type thing. That's usually where you get it off of, where they read a book about DHEA and say, oh, it's good for anti-aging, and this whole anti-aging craze, they go and they start taking a cream or a supplement for that. It also helps bring down obesity and diabetes. And I think the obesity thing is due to many women after menopause, when their estrogens start to drop from their ovaries and the kidneys are fatigued so it can't manufacture itself, making that smooth transition. The body, which is always seeking to stay the same, a process called homeostasis, which is a great deal mediated by the liver, says, hey, things are out of whack. We got to bring this back in position, and particularly the estrogens in this case. And so the women will start to gain fat or adipose tissue, which gives off a number of chemicals that have an estrogenic effect. And so they're doing that in regard to trying to equalize their body. And what happens is the woman looks in the mirror and says, hey, I'm getting fat. And how do you do that? Well, by replacing either estrogens in another way. So they start to use DHEA and stuff. And a lot of times what we find when we actually test, that might have been okay for them, but they're taking it in 10, 20 times too much and throwing things even further out of whack. Another interesting thing is that DHEA is regulated a great deal by what's going on with your blood sugar. Usually when people are going into metabolic syndrome, which is a process that can be through 15, 20 years of their life, first of all, that DHEA goes up to help them work against that increased blood sugar. And then what happens is when that gets fatigued or beyond what you can cope with, it starts to drop and cortisol goes up, and all of a sudden they have these heart disease things that come out from too high levels of cortisol. They start gaining fat around the middle, also in that apple shape rather than pear shape. And so it's all indicative of disease formats that are going on inside the body that are all mediated by the hormone changes that are going on in the body also. So you really want to look at measuring this to see how you can help them make a smooth transition and to bypass these deleterious effects. So DHEA is very, very important. One of the things that we were looking at is hot flashes. Hot flashes are precipitated by the hypothalamus in stating, hey, we're having decreased levels of estrogen and progesterone. Let's start secreting some of these stimulating hormones to bring this back. The ingestion of hot liquids can do this. Alcoholic beverages and caffeine and tobacco smoke, loud noises and stress can all signal the body to react and trying to adapt in a way that it's trying to adapt with the changes of the hormones, and it can't adapt as well. And part of that adaptation is the hot flashes that we find. So that's why some of these things can spur those on. Hot flashes are also known sometimes as power surges or vasomotor liability. They are not a sign of estrogen deficiency per se, but rather are due to heightened hypothalamic activity secondary to low levels of estrogen and progesterone, which if raised would produce a negative feedback effect to the pituitary and hypothalamus glands, and therefore it wouldn't have to react so much of a swing. So let's look at the hypothalamus gland. The hypothalamus gland sits just below the thalamus. Most of the signaling is initiated by the thalamus and goes through the hypothalamus on its way to the pituitary or master gland. This monitors your hormones with that negative feedback. It assists in regulating those hormone levels, again, through the negative feedback mechanisms. It gives off such things as follicular stimulating hormone or gonadotrophic releasing hormone, luteinizing hormone, and that helps regulate the endometrium. So the hypothalamus gland, located in the brain, about an inch above the pituitary gland, it monitors and regulates the hormone cycles. If hormones become low, the hypothalamus releases gonadotrophic releasing hormone, which tells the pituitary gland to release follicular stimulating hormone and luteinizing hormone, to which the ovaries respond by releasing estrogens and progesterone to bring balance back. This causes an egg to be released, which is called ovulation. The uterus is also involved in that, and with increasing its or thickening the endometrium lining. Remember, it's being prepared for an embryo, and it's built up by the estrogen and prepared for that implantation or fertilization. If pregnancy does not occur, then menses occurs, and this endometrium lining is then excreted, which is what you see at the time of menses. Now, adrenal glands and menopause, Dr. Lala.
Hey, the adrenal glands, we're still talking about them. How are they related to menopause? Adrenal glands also produce estrogen functions. And of course, after the ovaries cease to produce the hormones that God designed them to do, then if your adrenal glands are reasonably healthy, they're going to produce that. Interestingly, if you're going to a chiropractor who has x-rays of your spine and should check out that whole spine every time, but every time that they manipulate that spine, they're affecting the sympathetic and parasympathetic nervous system, of which the adrenal glands are very involved. So the adrenal glands affect our skin, our energy, our emotions, the fight or flight mechanism, calcium deposition in bone, and they inhibit the central or the sympathetic nervous system. So again, chiropractic is related from the spine aspect of chiropractic, not just the nutritional aspect, to the sympathetic nervous system.
Interesting that you would bring up how chiropractic helps that. One of the ways that they measure that is that they find after an adjustment, they can find that the heart rate and blood pressure goes down.
Right.
And so it's showing that it's taking us out of that fight or flight response or the sympathetic response back to more of a calm response,
And we have
which helps regulate those hormones also.
We have many patients who come in regularly for chiropractic spinal care, and it keeps their blood pressure down and normal, so they don't have to take anti-high blood pressure pills. So
Right.
some of the symptoms related to adrenal gland failure are dry mouth, circulatory imbalance, chills, flushing, hypertension or high blood pressure, tremors, internal nervousness, excessive perspiration. Now, some of the, let's talk a few moments about some of the aggravations of menopause. They are and include yeast infections or candidiasis, high fat consumption, consumption of cats or caffeine, alcohol, tobacco, and sugars, food allergies, poor diet, stress, hypoglycemia or low blood sugar, spinal problems, what we've been talking about, and lack of intercourse where they lack a sufficient amount of estrogens as well as testosterone. Now, we've been talking about estrogens and progesterones. Maybe, Dr. Jensen, we should spend a few moments talking about them, huh?
Okay. Well, estrogen, it builds up the bloody lining of the endometrium or the uterus. It's actually a thickening of the tissue. It's setting up the tissue to increase the blood flow to the embryo and the placenta, setting up that whole interface between the mother and the fetus. Progesterone holds the fertilized ovum in place in pregnancy. Progesterone actually gets its name by progestation, meaning that it maintains pregnancy. If pregnancy occurs, and if not, it ceases in production, allowing the endometrium to shed and the blood that was in storage in the endometrium, as well as that extra tissue that you usually see as the clots that are coming out. The two main hormones involved in the estrogen aspect of this cycle are estrone and estradiol, which we discussed previously. Estrogen and progesterone are antagonistic in some of their effects, but each sensitizes the receptor sites to each other. And the presence of estrogen makes body target tissues more sensitive to progesterone, and the presence of estrogen makes the same for the progesterone. So then we go on to the ovaries. The ovaries produce 20 to 24 milligrams of progesterone per day. So the logical dose when considering use of a natural transdermal progesterone cream would then be, if you have a depletion of that, is first to measure it and to see what you need to bring it up to the 20 to 24 level for more of a normal
And
function.
the most scientific and due diligent way of doing this through a 24-hour urine hormone analysis.
Right, because if you don't know that beginning or baseline, you can't manage it to what's the manageable level. So, extra ovarian aromatization. This aromatization is the biosynthesis of circulating estrogens. In the adrenal cortical steroidal genesis or creation of these steroids. So let's look at this. Circulating estrogens in the postmenopausal woman are derived from an extra ovarian aromatization or biosynthesis of circulating androstenedione. It is the product of adrenal cortical steroidal genesis, so it's taking place in the adrenal glands. Now, the remaining 20% of the ovarian origin are of ovarian origin. So before it was 80-20 from the ovaries to the adrenal glands. Now it's switching places where it's 80-20 this way. Because adipose tissue is primarily focused on peripheral aromatization, and since peripheral estrogen biosynthesis is a function of adipose tissue or fat mass, relatively thin women may be predisposed to experiencing vasomotor spasms. Conversion also occurs outside the adrenal glands and ovaries in the kidneys, skeletal muscles, and in the hypothalamus gland also. So, fats and aromatase. Remember how we talked about that this aromatization can take place in fats. So, what we have is aromatase is an enzyme that converts other hormones into estrogens, and its activity is largely based on the amount of fats within the body as well as hormone imbalances. If the person is over or under consuming fats and or if there exists hormone imbalances, then aromatase will initiate. Aromatization, or the conversion of fats into hormones. This estrogen being one that is when it is in excess predisposes people, such as men, to prostate cancer and women to breast, uterine, and ovarian cancer. So it's a very important process to take place.
And that brings up to my mind a statement that Thomas Edison is quoted as making when he was alive, that the doctor or the physician of the future will give no drugs, but interest his patients in diet and the care of the human frame. And of course, the main power line of the human frame is the spinal column. It houses and protects the spinal cord. It's connected to the brain, and so everything starts out in the brain, comes down the spinal cord. The vertebrae are like switches in the nervous system then. They affect not only our peripheral nervous system, but our autonomic nervous system, in that if we're not getting proper nerve and blood supply to our reproductive organs, to our thalamus, hypothalamus, pituitary gland, to our thyroid, parathyroids, to women's ovaries, to men's testes, then that body can't function the way it should be. And so that's what's so wonderful about being doctors of chiropractic, that we can look at that person the way God created them from a whole person perspective, look at their frame, look at their diet, and then internally check levels, markers in their blood and their urine for hormones and calcium and other things, and then know how that body is functioning and if there any corrections need to be made, hopefully without drugs or surgery.
It's to help accentuate the life that's inside of them.
So you have one body. They make all these claims about what these wonderful drugs are going to do, but ultimately over a period of time they prove that they also cause a lot of adverse reactions. So we're destroyed for lack of knowledge. Invite the great physician, Jesus Christ, into your heart. Welcome his power through the Holy Spirit, and you'll enjoy long life and good health.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.